You're listening to The Metro on 1019 WDET. I'm Kerry Jr. II. There's a measles outbreak in southeast Michigan. 7 people are confirmed to have contracted the disease in Ypsilanti, Ann Arbor, and Canton. None of those people were vaccinated against the disease. That's despite decades of data and medical practice that show the measles, mumps, and rubella, or MMR, vaccine is safe and highly effective. Vaccination rates have been going down for toddlers, school-age kids, and adults, making Southeast Michigan vulnerable to outbreaks like the ones we're seeing in Washtenaw County. So what's stopping people from vaccinating themselves or their kids? Should we be worried about the 7 cases, and who's most at risk when an outbreak happens? Dr. Rupuli Lemay is an associate professor at the George Mason College of Public Health. She's an expert in vaccine behavior, hesitancy, and acceptance. Dr. Lemay, welcome to the Metro.
Thanks so much for having me.
Thank you for joining us. Okay, so the current outbreak has 7 confirmed cases and exposure sites in 2 counties, including urgent care and emergency rooms. At this stage, how likely is it that the outbreak continues to spread, and how do you stop an outbreak at this stage?
Yeah, it's a really great question. So one of the concerns that we have about measles is that it's highly, highly contagious. So the issue here is that although the outbreak numbers seem relatively low across the 2 counties, it's likely that it will spread. And really the best prevention method for preventing measles is really the MMR vaccine. And so that's what we're really trying to do, is encourage folks to make sure that they're vaccinated and that they're up to date on their vaccinations.
Of the 7 cases confirmed in Michigan right now, only 1 person reported traveling domestically. What role does travel play in measles outbreaks?
Yeah, it plays a really big role, right? So if we think about the ways in which viruses are transmitted, measles in this case is spread by droplets. So if you cough on someone or sneeze on someone or a little too close to someone, it's easy for the virus to spread. And as I mentioned, it's highly, highly infectious. And so when you're in an airplane or if you're in a bus or if you're in a train, in any of these crowded places, it's really an opportunity for the virus to circulate. And so domestic travel does play a huge role. And again, because most people don't necessarily have symptoms for a few days, people could be having measles and could be exposing others to measles without even knowing it. And so that's really also a key challenge with regards to trying to prevent transmission.
What does that say then about when we travel, when we're in buses, when we're in planes? How should people then keep themselves protected?
Yeah, it's a great question. I mean, there are some basic sort of preventative methods that I would recommend. So, of course, sanitation. So thinking about washing your hands regularly, making sure you're specifically washing your hands after you go to the bathroom, before you eat. The other issue would be, if you are susceptible to different types of viruses, a lot of people are still wearing masks. We do know that is a protective intervention that anyone can really do. But it is really, I think, making sure that when you're around other people, that you're taking precautions, right? And that you're noticing if there are people sneezing or there's people coughing. And if you know if there's other sick people around you, to protect yourself, right? Through those sanitation methods and or through wearing a mask.
Yeah, we haven't gotten away from making sure we wash our hands and wear a mask, especially in those closed environments when we're traveling. So how do we know the MMR vaccine, measles, mumps, and rubella, is safe and effective?
Yeah, the vaccine has been around for a really, really, really long time. And the great news is that it's been studied extensively. And so this vaccine is actually recommended. It's a 2-dose vaccine that you normally get your first dose somewhere between 12 and 15 months, and then the second dose around 4 to 6 years. The great news is that if you have gotten both doses, it reduces your risk of severe any of the diseases, measles, mumps, rubella, by more than 95%. And so it is highly, highly effective. And as you can see, and as you mentioned, the outbreaks that we're seeing, the people that are getting infected are primarily more than 95% among those that are not vaccinated. And so really you can see how effective that vaccine is and how safe it is. There have been thousands of studies that have looked at the safety of the vaccine and have shown that it does not only confer immunity or safety and prevention, but it also is quite safe for people to take. And that's really the big concern now. We've seen a decrease in the number of parents that are getting the MMR vaccine for their children. And that's one of the reasons we're starting to see more outbreaks, because usually those that are younger in age, under 5 or really under 20, are those that are most infected and affected by measles, as well as those in the older age populations.
I'm glad you brought that up. We're going to get to that in probably a couple of minutes, but I do want to ask before we get to that real quick about kind of the goal here. We want to get to a level of protection for all of us. Can you just describe kind of what that means, what protection or full coverage means?
Sure. So the whole reason, and the reason that a virus exists is that it wants to replicate. It can only replicate and spread is that if it has a susceptible host, right? And so the way that I think about the immunity within a community is that if many, many people are vaccinated, the host has nowhere to go. And so when we think about the ways in which we want to think about public health and protecting the health of the public, it's important that we have a threshold of individuals that are vaccinated, because as a result, the virus then dies out. The problem that we're facing now is that we have slipped below that threshold. So there are more susceptible people than needed to essentially have the outbreak peter out. And so we will continue to see cases, unfortunately. The goal for us, though, is to really reduce severity of those cases. Measles can cause a number of different things, the most common being diarrhea and pneumonia. But in many cases, it causes something called immune amnesia. And what that means is that it essentially erases your immune system memory, which makes you susceptible to lots of other viruses, bacteria, fungi in the future. And that can be really, really life-threatening. And so, again, our goal is to ensure that we are reducing severity of the disease and hospitalization. And at the moment, I think measles cases that I think from last year, the 2,300 or 2,400 we had last year, about 17% of those were hospitalized. We really want to prevent that.
I see. And so what percentage of people do we need to get vaccinated against measles?
Yeah. So, although it's a highly, highly, highly effective vaccine, it does require sort of, I think, high level of threshold of population or community immunity, and that's usually above 95%. The thing is that in many counties, the MMR vaccination rate may be above 95%, but as you know, there are pockets where it will fall below 95%. And that's really challenging. And what we've noticed in some of these outbreaks, like in South Carolina, for example, as well as Texas, is that they're really starting in areas where the immunity in the community is quite lower than 95%, which really allows this virus, as I mentioned, to find a susceptible host and then to spread.
I see. You're listening to The Metro on 1019 WDET. I'm Carrie Jr. II. My guest is Dr. Rupali Lemay, an associate professor and vaccine behavior expert in the Department of Global and Community Health at George Mason University. There is currently a measles outbreak in southeast Michigan with 7 confirmed cases in Washtenaw County and exposure sites in Ypsilanti, Ann Arbor, and Canton. None of the folks have the MMR vaccine, which protects against the measles. All right, so Dr. Lemay, childhood vaccination rates, you spoke about this a little earlier. I want to return to it here. It's declined sharply in Michigan since 2024. The percentage of toddlers who have received a full series of vaccinations, which includes protection against measles, is now down to 66%. What are the possible long-term consequences of a toddler or infant getting the measles?
It's a great question. And as I mentioned, I think that measles really affects those that are younger. So usually those that have more severe manifestations of the disease are those that are under the age of 5 or older populations. And I think my biggest concern is that, sure, a lot of kiddos that do get measles, they may get diarrhea, but they could have pneumonia, which could become life-threatening and could cause complications. But they could also have, as I mentioned, this idea of immune amnesia. And that to me is more concerning for sort of the long-term effects of someone's immune system. So if all of a sudden your immune system doesn't remember that you've been exposed to a cold or to COVID or an influenza, whatever it may be, it becomes harder and harder for your body to fight it, which can lead to, unfortunately, more severe manifestations of the disease. And so that's really the concern. It can also cause brain damage, and that does occur in, I think, 1 in about 1,000 children. But given, again, that rates are declining, that we're seeing the number of cases increasing, I think in the United States we're almost above 1,600 already in this year. I think there are going to be more severe manifestations and more severe consequences. And that, sadly, we're going to continue to see that over the next several years and into as these kiddos grow up. Unfortunately, they're just going to face more life-threatening health issues as they grow older.
And something like that, that immune amnesia, that would last all the way through until they get to, through adolescence, all the way to the growth to adulthood? Oh, wow.
Yeah, that is exactly right. And and that's really the big concern. I think a lot of parents will say, oh, measles isn't that harmful, right? It's sort of this rash. Your child is irritable for a little bit. They could have sort of diarrhea for a few days. But I think, to me, that's what really needs to be communicated, that there are these long-term effects. And there's also, again, a chance for, unfortunately, brain complications to occur, which is even more concerning with regards to brain development at that age.
So Michigan requires students to have proof of vaccination for kindergarten and 7th grade, but parents can submit a vaccine waiver for certain health, religious, or philosophical reasons. Those waivers are on the rise, but the school vaccination rate is still at 90% in Michigan. 90% seems like a pretty high number. You did just talk about 95% for herd immunity. Should we be concerned about this rate in school? What should we say about those kinds of numbers?
I mean, again, I think 90% is great compared, you were saying, to the rest of the state, which is around 66%. However, I think, for us to really ensure that an outbreak will be prevented, we do need to be above 95%. And so while I know that more parents are opting for these exemptions, and, before it used to be that parents can really go in, and usually it's a medical exemption, meaning a child cannot get the vaccine because it's contraindicated. Then that sort of expanded to this idea that parents can use something called philosophical exemptions, meaning that they don't agree with a vaccine and don't feel that their child needs to get a vaccine. And so there have been changes in the ways in which exemptions have been handled at the state level. And while 90% is relatively high, again, the challenge is going to be that even, let's say, in schools it's 90%, we know in certain pockets of the community and in the county, it's closer to 66%, as you just mentioned. And that's what really makes it really ripe for an outbreak to occur. And the problem is once an outbreak occurs, it becomes such a challenge to control it. And as you can see in the U.S., we've had multiple outbreaks ongoing for several months now that we've been unable to stop. And that's simply because, as I mentioned, the measles virus is very contagious, and it really does a great job, meaning it's very efficient in finding people that are susceptible, i.e. those that are not vaccinated. And so therefore it allows it to live and allows it to spread.
Well, how do you communicate to folks about this kind of concern? I want to be clear, too, that I'm not saying that the folks who are issuing these waivers are the reason why the rates stay at 90%. That's just not clear from my perspective. But I do want to highlight, you have folks who have waivers that allow them not to do this. On the other hand, as you've been outlining this whole segment, there's a need to get to 95%. There's a conflict right there that we have to move through. How do we begin to move through that?
It's a great question. And the reason that we're starting to see declines in vaccination coverage in pediatric vaccines broadly, but in MMR specifically, is really a decline in trust in our healthcare system, right? It's a structural issue. It's thinking about how do we improve the relationship that a parent has with a pediatrician? How do we ensure that that pediatrician is providing information that is accurate? And I think the thing from a public health perspective is that we really want to make sure that we all have the same goal. We want to protect the health of the public, right? But we also want to make sure that parents' concerns are listened to, that they're not dismissed, And so I do think that, thinking about those interactions between a provider and a patient are very, very, very critical. And they have to start with empathy. People have concerns. And as a parent myself, I understand people have concerns. There's a lot of information out there, and it can be really hard to discern what is true and what is not true. And so I think really focusing on that trust, again, that the provider is really focusing on is going to be, I think, critical for us. But also, I think being very empathetic and open and understanding that, this is a deadly disease. It is not something that we should just dismiss. We do have a product that can prevent it, i.e. a vaccine, and really helping people come to an informed choice based on information that is evidence-based, because that's what we're really seeing, is that people are unfortunately seeing and are being exposed to a lot of misinformation about the vaccine, and that's why we're really seeing a drop in vaccine coverage.
All right, Dr. LeMay, we've got about 40 seconds left here, and I just have one quick question, and it's kind of a big question, so apologies on it, but give it your best shot. This erosion you're talking about, the trust in healthcare providers and vaccines, is that an American phenomenon?
It's a great question. The Pew folks have been tracking this for a long time, and they've seen a decline in the healthcare system, but it is not unique to the U.S. We're starting to see this everywhere. So it's going to be a key challenge, and that you link that also with the politicization of health. I think in general, it's sort of the perfect storm to see really a decline in adherence to preventive public health measures.
All right. Dr. Rupa Lee LeMay, is an associate professor of the George Mason College of Public Health. She's an expert in vaccine behavior, hesitancy, and acceptance. And thank you very much for laying down the rules and guidelines and expectations around vaccines.
Thanks for having me.
Coming up, Oakland County's top health official says vaccine hesitancy is an epidemic. We'll find out how much daylight there is between federal and local vaccine policy. We'll be right back.